Alex, and today we'll be talking about drug abuse and what are the consequences for the body. First thing, what is the definition of abuse? Abuse is when a person uses too much of something and it can harm themselves. What is drug addiction? Drug addiction is when a person begins using a drug and the person feels like they cannot stop using it. The person feels they need to use it every day to survive. There are many drugs in the world, but today we only focus on three kinds of drugs: alcohol, crocodile, and smoked cigarettes. What is alcohol? Alcohol is a legal 10% drug which changes the way people feel and how people act because of the way it affects the brain. It is a drink can cause serious consequences in the body and society. There are many kinds of drugs of alcohol like beer, wine, and hard liquor like tequila, vodka, whiskey, rum. Why people use alcohol? People use alcohol because their friends and family drink, because it makes the people feel different from that we are really feeling. And some cultures even use alcohol in religious ceremonies like communion or the Seder. What are the consequences of using alcohol? People who use alcohol don't think clearly. They can cause accidents or they say or do things they don't say normally. Sometimes they can get trouble with the law or go to the jail. Drunk people can be dangerous to those people around them. They can cause accidents if they are driving. People who drink alcohol may be victims or the perpetrator of sexual assault. At first, people feel happy, relaxed, and forget their problems. Later, they may feel sleepy, angry, or confused. If people feel happy, the alcohol will make them feel more happy. But if they feel sad, the alcohol makes them feel even more sad, angry, or depressed. When people drink alcohol, it absorbs into the blood quickly and it stays there about 2 hours per drink. For every ounce of beer, 6 ounces of wine, or 6 ounces of liquor, the intestines and the stomach absorb most of the alcohol. People who drink alcohol lose their coordination, have trouble thinking, lose memory, lose their speech, have blurred vision, or muscle weakness. If people continue drinking alcohol, it can affect the body in many ways. It increases the risk of cancer in the liver, breast, esophagus, pancreas, mouth, larynx, and pharynx. In the liver, it can cause fatty liver, which can lead to inflammation of the liver, can cause hepatitis. It also causes cirrhosis when the liver cells become damaged. They cannot regenerate. Cirrhosis will eventually kill the person. Drinking alcohol increases the risk of breast cancer. In the stomach, alcohol can cause irritation and inflammation, which can cause ulcers, bleeding, and chronic diarrhea. This may lead to anemia. Drinking alcohol can cause pancreatitis. Pancreatitis is the inflammation of the pancreas and can cause pancreatic cancer. In the heart, alcohol can cause cardiomyopathy, which is the stretching and dropping of the heart muscle. It can also cause myocarditis, which is the inflammation of the heart muscle. It can also cause arrhythmia, which is the irregular heartbeat. Drinking alcohol raises blood pressure and blood fat. It can lead to hypertension, high cholesterol, and stroke. Alcohol can deteriorate a person's bones and increase the risk of breaking a bone and can lead to osteoporosis. Alcohol can cause cell damage in the nervous system, can cause neuropathy. Neuropathy can cause weakness, burning, pain, and numbness in the feet and hands. When a pregnant woman drinks alcohol, it can have several consequences for her and the baby. The baby can born with FAS, which stands for fetal alcohol syndrome. FAS can cause mental retardation and birth defects. This can cause difficulties for the baby in its future. Alcohol affects the frontal lobe first. It makes the brain work slower than normal. The frontal lobe controls decision and making the coordination. Alcohol blocks the hormone that tells kidneys and absorb water, making the person go to the bathroom. This dehydrates person causing head and body aches the next day. In the cerebellum, alcohol can cause loss of balance and difficulty walking and standing. Drinking alcohol can cause blowouts when you don't remember what you say or think the next day. If you want to drink alcohol, just remember what are the consequences when you drink alcohol. It can have, you see some consequences it have. Just thinking before you drinking. Dysmorphine by the street name Krokodil is extremely addictive. It's an injectable opioid, which is a psychoactive chemical that reduces a person's ability to feel pain and increase pain tolerance. Krokodil was first used in Russia in 2002. It was used by addicts as an alternative to heroin because it was cheaper and stronger. Krokodil is made from codeine mixed with alcohol, gasoline, red phosphorus, iodine, hydrochloric acid, and paint thinner. Krokodil is used by people who are really addicted to drugs. Krokodil is 10 times stronger than codeine. It's also cheaper than heroin and easy to make. Getting high ones on Krokodil costs $8 and getting high ones on heroin can cost up to $40. When people drink Krokodil, it eats the body from their inside out. It causes blood vessels that burns and kills surrounding skin tissues. Krokodil destroys body tissues the way battery acid eats through plastic. Krokodil can cause organ damage, mouth, skin lesions, and can make people look older than they really are. Krokodil is dangerous because it eats the body from the inside out and makes the skin look very black and damaged. It's dangerous psychologically because it can cause confusion, slurred speech, and impaired coordination. It's also very addictive. The best way to prevent use is to stay away from drugs in general. The best way to help a person addicted to Krokodil and other drugs is to find a drug counselor and take the person to see them regularly. If the person is in severe pain or has severe damage to the body, you can call 911 or take them to the closest hospital. Smoke is created when tobacco leaves and burns in cigarettes. People smoke cigarettes because the smoke contains nicotine. The nicotine is more addictive than the alcohol, cocaine, and heroin. Nicotine is a stimulant and relax. It can also cause people to lose weight. It decreases anxiety and increases dopamine and dopamine in the brain. Cigarettes smoke contain more than 4,000 chemicals, more than 50 can cause disease. Many organs and body systems are negatively affected by tobacco. Smoking can cause heart attacks, circulatory problems, aortic aneurysm, high cholesterol, lung cancer, cancer of the mouth, throat, and voice box, and urinary bladder, pneumonia, and lower your immune system ability to fight the flu. The common cold, peptic ulcers, Crohn's disease, tooth decay, gum disease, osteoporosis, and sleep problems. Cataracts, thyroid disease. Smoking can cause cancer all over the body. The most common cancer from smoking is lung cancer. 159,000 people in the US die from cancer lung every year. If people drink and smoke, it greatly increases the risk of getting cancer. If a pregnant woman smokes cigarettes, it can have several consequences on the baby before it's born. Smoking cigarettes can cause the fetus to grow slower than normal. It also greatly increases the chance of a miscarriage and death immediately after birth. After the baby is born, women can still pass chemicals to their baby through breast milk. Some people don't like the smell. They can also breathe and cough. Secondhand smoke is not good for the health of the person because it can cause disease and can be even worse than the smoking firsthand. Don't smoke. If someone offers you a cigarette, thinking about the consequences it can have on you and the people around you in the future. If you become addicted, ask a counselor for help and don't smoke.
So some of the physical consequences of using drugs come in the shape of how it changes the body. It can happen both inside and outside. So sometimes it can affect, depending on the type of drug, and it can affect your teeth or your gums. It can affect your ability to control your movements. Certainly when you're under the influence, that's the biggest thing that people notice, is they don't seem to have control of their body, their limbs, their arms, their hands, their feet, things like that. Their eyes sometimes can't track movement the same way. So there are a lot of different consequences when you're under the influence of drugs or alcohol. There's also consequences that can happen internally. So sometimes it can cause differences in your body chemistry or changes to your mental state. It can cause changes to your organs if it's a really severe or toxic drug as well. And those impacts last much, much longer even after you've stopped using the drug and you're not under the influence. So there can be a lot of different effects and they can be pretty severe. For a person to stop using drugs or alcohol, especially if they've developed a really significant habit, it can be very tough. It depends on how long they've been using, when they started using, and then the availability, so how available it is for them to get it. So sometimes with alcohol, since it's available in a lot of places, and the temptation becomes really strong to continue using the drug or alcohol, that makes it difficult to change your habits and to be rehabilitated. What's important for anybody who wants to become healthy and stop using drugs and alcohol is that they have to make the decision to get help and to stick with it once they start getting help. That will be the biggest thing to make the process easier. My biggest area of focus with a young person who confides in me that they're using drug and alcohol is first that we want to talk with their family right away. It's important that when you're trying to change a habit like using drugs and alcohol that you have support, people who care about you and love you and want you to get healthy. So that's the first most important thing, is to talk to their family. After that, I try to provide resources about drug and alcohol rehab programs. So sometimes they're outpatient where they just go and talk with a counselor. Other times some people need more intensive programs, maybe even at a hospital, to make sure they can get healthy in a safe way. So it's really important that we figure out what's going on for that individual student with the family and maybe their doctor to make sure we get them the help they need. I think there are a lot of reasons why a person might use drugs or alcohol, and the main thing I worry about is their safety, because those physical consequences they could have, the changes it makes to the relationships they have. Sometimes they can be in unsafe situations when they're using drugs and alcohol, and so that's my biggest concern. So whether it's a young person or adult, I want to get them help. My hope is to get them help so that we can help them be safe and healthy and have choices in life and not have the drugs or alcohol controlling what they do. It's really difficult when talking with someone who's thinking about using drugs and alcohol for the first time to help them understand why that's not a safe choice. So a lot of times I have to talk to them about what can happen even from the first time they use drugs and alcohol. It may be that they're in an unsafe situation and they get hurt, even though it may not be the drugs or alcohol, it may be the people that are around them. Other times, if it's a very scary drug, a very severe drug, they can be physically hurt or even die from just one use. So sometimes I try to really help them know that it's dangerous every time you use drugs. Doesn't matter if it's your first time or your 100th time, it's always dangerous. And hopefully that'll reach them and help them understand that there are other things they can do. They don't need to rely on drugs and alcohol for fun or activity.